And a recent video shows Tom Cruise fighting Brad Pitt, but it's fake. It's completely AI. Jake Tapper sits down with the SAG-AFTRA president, Sean Astin, and talks about what the very convincing video means for the film industry.
Well, a bunch of things. First, you think, well, that looks pretty realistic. And then you think, well, there's another example of mass copyright infringement. And then you think, how long is it? Because is the tech there for it to sustain, longer formed entertainment? And then I think it's time for us to once and for all enshrine a federal intellectual property right in voice and likeness, and 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 a lot of other stuff. I think um, you said one thing. You said it sparked a big debate. I don't think there's a big debate. I think some people want to use it and some people think it's wrong and you got to stop it. Well, it doesn't matter whether I believe them or not. It matters whether they do that or not. OpenAI had a similar issue, and they very quickly reinforced the idea that they had an opt-in policy, even though they were sort of in an opt-out modality, meaning performers can see themselves. Bryan Cranston can see himself and say, hey, you're not supposed to have that. And they go, oh, sorry, take it down. Or they can say, hey, Bryan Cranston, we want to use your image and likeness. Can I get your permission? And he'd have the opportunity to make that decision and get compensated for it and so forth. So I hope that they see the public outcry to not abuse people's rights. And I hope they choose, to do what they said they're going to do. In the meantime, we have an important piece of federal legislation called the No Fakes Act, which is in the Judiciary Committee now in the Senate, and it would enshrine that right to our own voice and likeness. And you know, you're a journalist. Your job is to make sure that the First Amendment is protected and is respected and observed. And in the entertainment industry, both the companies and the talent have the same sense of um, reverence for the First Amendment. But you shouldn't be able to make me say something I didn't say, or do something I didn't do, or depict me in a way that I wouldn't, in a setting I wouldn't put myself. That's just basic fundamental fairness. It goes not just to the professional entertainment industry, it goes to kids who are abused in this way. It goes towards anyone in our country and around the world who is, when they post stuff on social media, when they find themselves, their images captured in whatever ways, that they are subject to this same sort of abuse. So it's time to put real guardrails in place that protect us.
Well, there has been a long time debate over childhood vaccines as Health Secretary Robert F. Kennedy Jr. pushes to repeal some child vaccination laws. This year, the Department of Health and Human Services reduced the vaccine schedule, citing Denmark as a successful example of a leaner approach. Well, we head to Denmark to see if their model can be copied in the United States.
Denmark has long recommended fewer childhood vaccines than the United States. Babies here leave the hospital without any shots. By the time they're 12 years old, most Danish children have received vaccines against 10 diseases. Now compare that to the United States. Until recently, American officials recommended children get vaccinated for 17 diseases. Now 6 of those are still available, but no longer recommended: hepatitis A and B, meningitis, rotavirus, flu, and COVID-19. Some of those, like hepatitis B, are still a serious threat in certain parts of the United States, but not so much in Denmark. About 6 in every 100,000 Americans are diagnosed every year with chronic hepatitis B. Compare that to less than 2 per 100,000 in Denmark. That means around 18,000 Americans diagnosed every year compared to about 100 in Denmark.
So this is a referral hospital.
That's right.
Dr. Jens Lundgren is a specialist in infectious diseases. He sits on the panel that decides which vaccines to give Denmark's children.
Did it surprise you when you heard that the United States is trying to emulate their vaccine schedule on Denmark?
Yeah, I certainly didn't see that coming. You cannot just take what has been carefully thought through in one geographical location and just extrapolate that and generalize that.
I think part of the reason that they emulate Denmark is because Denmark has the fewest vaccines on the schedule.
But you see, that's not a good argument, right? So why do you want to condense your vaccine program against the fewest vaccine? You want to have the right vaccines for the public health that you have in your population.
You believe these vaccines that we're talking about on the childhood vaccine schedule, you believe they are safe and effective?
Correct.
That's not the concern
That's not the
here.
debate here.
So what is it fundamentally about?
We have come to realize, after have made some mistakes also early on in how the vaccine program, that it's entirely based on trust. The trust, parents need to trust when we come with a new vaccine into the program, they need to trust that that's very sensible to do, and they would therefore adhere to that.
Lundgren and his colleagues are now considering adding another vaccine, the one for chickenpox. Most Danes trust their government. Of the world's most advanced economies, it ranks near the top. And here's the United States, dead last. Just 28% of Americans trust the government. Danish trust in government goes far beyond vaccines. Even after parents leave the hospital, child rearing looks a whole lot different here.
I want to show you something pretty extraordinary. We've come to visit 2.5-month-old Esther. Of course, we expected to find her inside the house, given how cold it is, but instead, here she is in a stroller outside, freezing cold temperatures.
You'll see this everywhere in Denmark. Parents swear by the fresh air for their heavily swaddled babies. The family is waiting for a home health nurse to arrive, who will come, free of charge, 5 to 6 times during the baby's first year of life.
Du er så stærk. Ja. Skal vi starte med at veje dig? Eller skal vi starte med at måle dig? Hvad? I får jeg ikke smil.
What I'm struck by is Denmark is so different than the United States. You're here. Parental leave, nationalized healthcare system.
Obviously, there's a lot of people in the US who are not that fond of the government actually running anything at all.
It's 2 completely different countries, right? And it's run differently and politically, governmentally. But I would want for the people in US to have some of the benefits that we experience, because I do believe it benefits me as a parent. I believe it works. So I basically trust the system, right? That they have decided it for me and it works.
Vaccination isn't the only reason that outbreaks are less common here in Denmark. The National Serum Institute, or SSI, here in Copenhagen, keeps meticulous medical records of all Danish citizens, helping them track illnesses to help predict and even prevent outbreaks.
What makes Denmark's superpower this data tracking?
Whenever someone is tested for something, it goes into one database. Whenever someone is vaccinated, it goes into one database. It doesn't go to all kinds of places. It's one place. And then it's quite doable to link all this together.
Americans might be uncomfortable with that level of tracking, but it is one of the many factors that makes the Danish system work. It's easy to see reflections of the Maha movement here. Danes emphasize personal health to ward off disease, and they are skeptical of too much medical intervention. But the success of the Danish system is based on so much more than the number of vaccines parents give their children. Nationalized healthcare, high trust, and a lot of strong codependence on one another. Dr. Sanjay Gupta, CNN, Copenhagen, Denmark.